Welcome to the Aging Boomers. I'm your host, Frank Sampson. Of course, on our show, we discuss so many of the issues facing boomers, their parents, and what we know is an aging population, which I call smack in the middle of. I want to remind everybody that today's show is sponsored by Senior Care Authority, a senior placement and elder care consulting organization that has a national network of professionally trained and experienced local advisors to assist families. They'll work with you in determining the right path for you or your loved one and discuss various long-term care options, whether it's in-home care, assisted living, memory care, or you just need an advocate just to get some advice from. You can contact Senior Care Authority, an advisor in your area, so for a free 30-minute consultation with an advisor, you could call 888-809-1231 or go directly to the website at www.seniorcareauthority.com. I want to just thank everybody. I try to remember to thank everybody on each show for all your support. Our listeners are growing each and every day, and it's because we have great people on our show that we talk with from the industry, and we have another one today. And for those of you that want to share with people to listen to the show, we're not only on various radio shows throughout the country, but we're also on iTunes, iHeartRadio, Spreaker, Stitcher, and certainly you can go to our website at agingboomers.com. As I mentioned, we have a great guest today. We have with us Lisa Marsh Ryerson, who's president of aarp-foundation, the charitable affiliate of AARP. A bold, disciplined, and collaborative leader, she sets the foundation's strategic direction and steers its efforts to realize an audacious vision, a country free of poverty, where no older person feels vulnerable. Since she took the helm, AARP Foundation has developed pioneering initiatives, explored new avenues for collaboration, and secured unprecedented funding to support programs that truly change lives. Lisa, it's an honor to have you on our show. Thanks for joining us.
Thank you, Frank. And let me tell you, the honor is mine. It's a real treat to be on the Aging Boomers podcast with you.
Well, great. We're thrilled to have you, and I know we're going to talk quite a bit about a survey that you recently conducted that we want to share with our listeners. But maybe first you could tell. I think people, for the most part, if you say AARP, they know who AARP is, all right, or certainly they've heard of you.
Yeah, of course.
But maybe you could tell us a little bit more about the foundation and the differences between the foundation and the AARP organization itself.
Yeah, happy to, Frank. That's such a great place to start. And, of course, I'm pleased that so many of the listeners and people know about AARP and the good work of AARP, and really delighted to have them know a bit more about AARP Foundation. As you said earlier, we're the charitable affiliate of AARP, and our mission is to work to end senior poverty. And, Frank, as you and I will be discussing, this is part of a growing issue. We focus on increasing economic opportunity and social connection for low-income older adults to be sure that they can secure the essentials in their lives.
That's fantastic. It's a wonderful organization. Just a wonderful
organization. Well,
thank
you. It is, and helping low-income and vulnerable older adults certainly has been part of AARP's mission from the very beginning, and we're delighted to have that mission focused here also at AARP Foundation.
Yeah. So I know you conducted a study back in 2010, and then you conducted another one again on loneliness and social connections amongst adults age 45 and over. And we're going to get into some specifics of that, but maybe you could give us an overview of how the most recent study, which you just got results from, kind of compared to the study in 2010.
Yeah, happy to, Frank. You're right. We fielded the first study at AARP Foundation in 2010 and then wanted to do this 8 years afterwards to look at several issues. One is just there's a growing body of education and information now, as you and I know, about this very important topic of loneliness and social isolation. We wanted to also think about some changes in the environment, the increased use of social media, for example, and what we would see. And, of course, we also know that I'm a boomer as well, and we know that we have an aging population with more aging older adults. so what we found is really interesting. The percentage of older adults who tell us they're lonely, just over a third, so 1 in 3 who are 45 and older, in fact, remain the same. But again, there will be more older adults who are lonely just based on the total number of individuals who are 50 and older in society. But then we found some interesting subsets of data within the survey, Frank, that I'm delighted to dig into a bit with you as we go forward. For example, the intersection of low income or living in poverty or moderate income and how much that can increase your risk for social isolation.
Yeah, I did look at, I cheated a little bit, and I did look at it a little bit ahead of time. And
I'm glad you did. It's a lot of information, Frank.
There's a lot of information, and as you know, I'm in this industry, and we're working with many of those people who are lonely, and trying to get them assistance. And you mentioned low income individuals. It's also mentioned in the study about unpaid caregivers, which, that's who we deal with. So I guess just selfishly, I like to talk to you a little bit about that. And when you say unpaid caregivers, many times we're talking about family members, all right?
Right.
They could be taking care of another family. It could be a friend, whatever. But can you maybe talk to us a little bit more about that and why you think that is, that they're feeling this loneliness? Yeah.
Happy to talk with you about it. And Frank, just given your vast background and expertise, I want to learn from you on this topic as well. But I think you and I know, and probably listeners as well, that the caregiving journey can be very, very isolating. And so you're often taking on your unpaid caregiving role as just one additional role in lives that can be full and very busy already. And when you're caught up in the task or journey of caregiving, as gratifying as it is to help those whom we love, you lose connection with your social network. So you don't have time to remain connected to other family members or friends or activities in your community that were important to you. And isolation has many, many factors, but is really predominantly about the size of your social network and the frequency and quality of contact with it. So think about all the caregivers that you and I have talked with, and in particular with whom you've worked. Easy to lose touch with your social network when you're caregiving.
Yeah, and especially those that are caregiving with somebody with cognitive issues. Certainly makes it quite a bit more challenging, and I'm not sure if the study got into that, or when they talked about the unpaid caregivers, did they talk about people who had family members with dementia or Parkinson's, or did it get into that level of detail at all?
Not as specifically, but certainly it looked at the whole category of unpaid caregiving, and then what you and I know is that when you're providing care for an older adult in your life across their lifespan or aging journey, the likelihood now that you will be addressing issues of dementia and other chronic diseases is high.
Yeah, absolutely. And another category, which is not surprising to me, only because of work that I've done, and I've just interviewed somebody on the show just recently who has an organization to help educate caregivers on working with the LGBTQ community. And it's kind of ironic. Yes. I just did that interview recently, and but that's a category of increased risk for chronic loneliness. Can you maybe expound upon that a little bit as well?
Yes. Frank, let's spend some time on this because it certainly is. And so the study found clearly that older adults who identify as LGBTQ, 14% percentage point increase in loneliness for that population. So it's significant, Frank. And important for us to know this as we think about outreach, just as your previous guest was talking about, planning interventions that truly meet the needs of an individual who identifies as LGBTQ is really important. And when I think about it, it also relates to just societal issues and access in community to health care, to resources, to activities. Without that access, which can be the case for some LGBTQ individuals over time, they increasingly become isolated. And I've been curious recently, wonder what you've been hearing or what you experience as you're working with individuals who are looking for housing, senior housing or long-term care. There certainly is some dialogue about how difficult it can be for an LGBTQ elder when they look for senior housing, and how some might feel that they cannot be themselves.
Right. Yeah, it's a challenge. There's no doubt about it. And especially those that are being placed somewhere where there's cognitive issues going on with the other residents. I have to say I haven't seen it as much with caregivers as I see with the other residents. And as you probably know, and I'm not sure all of our listeners know, but somebody with dementia, that short-term memory goes first, of course, and then as that starts to get worse and worse, then that individual maybe when they were younger, they looked at those in the LGBTQ community at that time when they were younger, maybe on a negatively, and maybe they changed over time, but they're actually going back in time, and that bias comes back. It's kind of crazy.
Yes. Yes. That's an interesting way of putting it, Frank. But having loved and lost my parents and having dementia in my caregiving journey, I know what you're talking about when you talk about going into the long-term memories. So certainly as you're explaining it, biases or just life experiences emerge from many, many decades ago, don't they?
Absolutely. So
it's about that.
Yeah, right.
It's when we think about society, and really what you and I are talking about is not all of the systems have caught up, or communities, and there still is some structural or systemic discrimination. Mm-hmm. And so for LGBTQ older adults, ever more important that we're aware of increased risk for loneliness and isolation, and that as we're building models of care, we are building them as inclusively as possible.
Right. It's also, I'm a person that thinks future. I'm always thinking about the future, and I know, and I'm sure we could talk about it in the study.
So what's next, right?
Well, I'm going to make a prediction here. All right, that I think your survey, when you do it in the future again, it's going to be worse. And the reason I say I think it's going to
talk to me about that.
Well, because I think more and more people are choosing not to have children. All right.
Yes.
And I think as they age, all right, without children, and then they lose a partner or a spouse or whatever, and many are choosing not to get married. That's what the statistics show. So I think your study probably showed, I don't know, you'd have to tell me, that those that were maybe didn't have children or were single, did you find that their loneliness was higher than other categories?
Frank, you've hit on something. So I agree with you. You're right about your predictions in terms of, I would say, the growing number of older adults who will be on their own for a variety of reasons. And so, yes, it increases. Gosh, you and I could have several shows about this. It increases the need for caregivers, right? Who will be non-family member caregivers going forward. But living alone, or the death or loss of a partner or someone you're close to in your social network, is a key trigger for social isolation. So you're absolutely right that we might see the numbers of those who are suffering from isolation increase, which makes it ever more urgent that we pay attention to this survey and to this national and growing dialogue around the issue of loneliness and isolation. And I always say we need to grow awareness and educate, but then quickly we have to move from talk to action so that
Absolutely.
we're sure we're connecting people, right? But how many times do we have big dialogues and we don't get to the execution plan, right, to solve the problem? So you and I are people of action.
Right. And so let me give you I'm not saying it's a solution here, but every little bit helps. I want to get your thoughts on this. There's all sorts of surveys done. I'm not sure AARP has done it, but I've seen it where you're asking people, where do you want to spend the rest of your life? Well, everybody says, why they pay money for a survey. Everybody's going to say, I want to be home.
Yes, you're right, to the tune of 90% plus.
Right. Well,
I'm
surprised it's not 100%. To me, everybody, I want to stay home too. But being home alone, okay, especially if you're going to need care, is one of the reasons that, the study's showing what it's showing, and I think you're going to have increase loneliness. So I think we have to do a better job of educating everybody that being at home is a wonderful thing. Everybody would like to be at home, but it may not be in your best interests, both physically, cognitively, everything, depression, everything. So maybe being in a community that could be more independent doesn't mean you're going to a nursing home. I mean, that's the perception that people have. Either you're at home or you're in a nursing home, and that's not the case anymore. Things have changed. And so I was wondering your thoughts on that.
Well, Frank, I think you've really hit on it, is that there is, of course, when asked, yes, the survey data shows clearly that the vast majority of us always say we want to remain at home and be as independent as we can be. But it is true when you think about sometimes the home itself, I think what I hear you saying, and I would agree, can become the cause of increased loneliness and isolation, because there you are in a situation where you're unable to reach out not only to a social network but to the community supports that you need. So imagine if you're remaining in a home where you don't have access to affordable, accessible transportation, where you are distant from family members, or where you lose friends and loved ones because of death and are unable to rebuild your social network. So what's critically important is the ability to maintain a social network over time, people we can count on and who listen to us, who care for us, and that we're able to have frequent contact with that network. And then additionally, it's critical that we have the ability to access what you and I would call the social support. So that's everything from access to your community center or your exercise class to quality health care to your grocery store. All of those supports are important. So we don't want isolation. I'm agreeing with you. We want to be very careful and thoughtful. And it may be, I know, for example, with my parents while they were still alive, the first step was to not stay in their home, which wouldn't meet their aging needs, but to stay within their community where they could still attend the events that were important to them.
Absolutely.
Through their social network. Still, Frank, as you're saying, they didn't want to leave their house, but it was most important to remain in community.
Absolutely. I don't know if it was in your survey or I read this in another one, but it had to do with social isolation, showing that it's been found that that people are they are worse for health than obesity. At least social isolation. And the health risks of prolonged isolation are equivalent to smoking 15 cigarettes a day. I don't know how.
That's right, and it was in the study.
Oh,
but
it was?
It's been in many studies. It's been in many studies. The 15 cigarettes a day was a separate study, but one that I quote frequently, and know Dr. Julianne Holt-Lundstedt, the researcher on that study. But it draws this very fine point on an issue that is this growing public health concern. So think about it. If the negative health outcomes are the equivalent, worse than obesity, bad for cardiovascular health, sustained loneliness has a very high percentage rate of early death, smoking 15 cigarettes a day, we all know that the benefits of finding sustainable solutions will be incredible not just for the individual, but also for communities. Frank, I also want to share with you, not sure if you've had a chance to access it yet, but there was a very important study that was published by AARP's Policy Institute earlier this year, and it was looking at Medicare spending. And of the about 4 million Medicare participants who are found to be socially isolated, the annual increase in Medicare spending is $6.7 billion a year.
Yeah.
And on an individual level, it's $134 more dollars per month on the individual. So I think we need to solve this because it's the right thing to do, because the health impact is so negative for individuals, and because if individuals are isolated, we lose their contributions in our communities. But also, the healthcare costs and those consequences are significant as well.
Right. So I know one of the areas, so we could talk about the problem. Let's talk a little bit on how we could help solve, I don't know if we'll solve the problem, but make it better.
Yes.
But, getting to know one's neighbors certainly can help reduce loneliness, and it shows that in your study. All right. Talk to us about AARP's foundation and some of the tools that you have to help with this challenging issue.
Thanks for allowing me that opportunity, Frank. I want to start with being a good neighbor, which is so important and pretty easy if each of us in our communities nationwide decided that we would be more mindful neighbors and be on the lookout for older adults who could be lonely or isolated or in need. It will go a long way toward solving this problem. The study showed that for older adults who do not know their neighbors, 64% of them are lonely, compared to only 25% who know their neighbors. So, knowing that, with our survey, the foundation participated earlier in September, on September 28th, what is National Good Neighbor Day, as a way to educate all of us across the nation to look out for our neighbors, to knock on our neighbor's door, ask people how they're doing, have a cup of coffee, take someone to run their errands, for example. And we have proof that being a good neighbor and having good neighbors is important for health outcomes. So that's one area. We are kind of tying all of that up into a platform. I would want listeners, if they're able, to go check out connect2effect.org, which is a platform that demonstrates AARP Foundation's long-term commitment to addressing this growing issue of social isolation. And on it, listeners will find articles, research, also an assessment tool. Very easy to take if you want to know what your risk factors are or what your level of potential isolation is, or you could take it for a loved one if you're a caregiver or concerned about someone. And then, Frank, you can put in your zip code and be connected with resources in your community, direct resources. So I think that's a good option.
That's fantastic. So that's Connect. That's, if I'm tell me if I'm correct here. It's Connect, CONNECT, the number 2, effect, AFFECT.org. Is it?
You've got it, Frank.
Right,
you heard it absolutely accurately, and we're really see this platform as a collaborative initiative. It's we work in collaboration with some organizations, with the Gerontological Society of America, with N4A, with Give an Hour, and with United Health Group, and many, many other organizations who are providing their expertise, research, and just practical solutions or evidence-based solutions that are working in communities. For example, listeners will find videos, that sort of growing movement of community choirs, where older adults are finding that if they take that first step and reach out and continue with a hobby or a passion, they can address the isolation or loneliness that's existing in their life. But we're also innovating, Frank, and so I'm curious to know, given your vast background, what you're seeing in senior housing in particular, or with individuals you're working with. So, for example, in the area of technology, the study confirms, I think, what we all intuitively know, and that is that technology is very important to facilitate connections. So learning to use Facebook or FaceTime, being able to remain connected to resources through the internet, really helpful for isolated older adults. But it's no substitute for one-on-one or human connection, which we need to thrive across our lifespan and health span. But we're looking at technologies such as voice-activated technologies, and in particular have a pilot project going where voice-activated tools are installed in low-income or senior housing, and both activities directors and residents are trained on the use, and then the voice-activated technology, which is, I call it a leapfrogging technology because you just have to have your voice to use the technology, can cue residents about activities that are taking place or meetings that are happening, or residents can stay in touch with music that they love and invite their friends in. So that's an example of something interesting.
I'm seeing more and more assisted living communities, even smaller residential care homes around the country, making sure that they have caregivers that are trained to work with the residents so they can, like you said, use a FaceTime or something like that to connect with grandchildren, other relatives, and it makes a huge difference. Certainly it isn't a requirement, but those that do it are going to, these are mainly privately owned organizations, and their business is going to grow by doing that and promoting it. So I think what you're saying is absolutely correct. I mean, it just needs to be done. It needs to be done.
It really does. Yeah. We also have been studying, again, another area or that has to be addressed, both in terms of built environment and communities. But, as we said earlier, the lack of access to reliable, affordable transportation is a real problem as people, as you age, if you have issues with mobility or you're not driving any longer and are so cut off from services. And yes, we have a growing number of services that will remain important that deliver services to us in our homes. But I think we all know, I might be in the minority here in D.C. I don't think I am, but I love to go to the grocery store. I see my neighbors, you talk to people. Right. So you can imagine those, running our errands as a community activity. And so we've been running a research project with USC and Lyft and United Healthcare to provide, for a period of months, unlimited rides using ride-hailing apps. So training older adults who are isolated to use the application, or they can call in and do it not through the app but by phone, have access to transportation, both to get to your doctor's appointments, because that's so important for ongoing health, in particular given the high number of older adults who miss not just primary care appointments but subspecialty appointments. But the rides can also take you to the grocery store, out for lunch with your friends, to a movie, and already the findings are showing an increase in connection for the older adults who are isolated and have access to transportation. So, long way of saying it is true we need to work on transportation and be sure that individuals can make their own choices. As we age, we want to tap into our own agency to continue to enjoy what we love.
Yeah, and I'm seeing more small companies starting up to fulfill that type of need in communities. All right. For transportation, I know you said you're working with Lyft. I've heard of Uber doing some things to try to also hit the senior community and help them as well. So us boomers, we're pretty demanding, and I think that we'll I think people are becoming more and more innovative. Boy, I could talk to you all day on this subject matter, but unfortunately we're running out of time. But I do have one thing that I'd like you just to share with our listeners, and that's how can, the things that you're doing in the foundation, number one, how can people get involved with your organization, whether it be just their own time to help, maybe they want to help financially, share how people can do that.
Yeah, many, many ways. One is we want to tap into people's good ideas because we do believe that co-creation and innovation is a way forward. So know that We're easy to find at aarp-foundation.org, and communicate with us. Information about organizations that are doing great work, ideas that people have. As you said, and I appreciate it, Frank, we're a public charity, and we fuel our work based on donations. So for those who are as passionate as we are about ending senior poverty and ending loneliness and isolation among older adults, we appreciate your financial support as well. We also need volunteers always at the foundation, and volunteering itself is a way for us as individuals to remain healthy and connected. So plenty of volunteer activities, whether it's tutoring school children in underserved school, where we run a program called AARP Foundation Experience Corps, serving as an AARP Foundation tax aid volunteer, or many other ways. And then for the listeners who are clinicians or involved in the many roles that make up healthcare across this nation, know that we have on our mind a desire to grow education on this topic and to think about possible screening. What the survey showed is that very few individuals are ever talking about whether or not they're lonely or isolated with their physicians or clinicians. And so we're very much interested in growing the dialogue about what would be effective screening tools. As importantly, we all know we can't screen if we don't intervene. So what are the interventions or solutions that we agree to support in communities across this nation?
Great. Lisa Marsh Ryerson from the AARP Foundation. Lisa, thank you so much for joining us. Wealth of information. And I want to just thank everybody out there for joining us as well on the Aging Boomers. Just be safe out there, and talk to y'all soon.